Okay, I think we've started. Everyone who's joining, thank you so much for joining this very special webinar for the campaign 10K to Zero. We're going to start in just a couple of minutes to let a few more folks who registered join in. You will have the opportunity to put some of your comments or questions to our illustrious panel into the chat so we can keep the conversation as streamlined as possible. And perhaps we'll set some context while we're waiting for more of you to join in, because there were several hundred registrations. We'll be discussing, of course, some of the horrific stats around India's suicide crisis when it comes to young suicide. So please, a reminder, if any of you are feeling distressed, please feel free to exit the conversation, seek help. We have a list of helplines, for example, on the Health Collective. We have helplines up on the Center for Mental Health Law and Policy site. And please know that help is available, that you're not alone. We will be talking about suicide prevention, suicidal ideation, and a reminder that the WHO has said that this is a public health issue, a serious public health issue that requires a serious public health response. Some of you may not know that this is a multifactorial, very complicated issue, which is perhaps why a lot of folks don't really want to talk about it. And one of the reasons for this campaign is to get more and more of us involved to make sure we can bring this awful number of deaths by suicide of young Indians down to zero. And there are many timely, evidence-based, and often low-cost interventions that can help us prevent suicide. So every one of these deaths is a preventable death. And we're going to bring in our panel of experts to talk to you about why and how we can all get involved. It's also not just a mental health issue. This might be also a note that, some of us sitting in India and South Asia need to realize it's not just about mental health. Without further ado, and hi, Vijay, and I can see some of you saying hi in the chat. Lovely for all of you to be joining. We have panelists all over the world, which is wonderful. We have Chandra Ramamurthy, who's joining us from Melbourne. She's a lived experience researcher at the University of Melbourne, appearing for her PhD. Also has over 2 decades of experience in India's not-for-profit sector. So really excited to have a conversation with Chandra. We have Dr. Lakshmi Vijayakumar, the founder of Sneha, who's of course a legend, the legendary presence with us today to talk about some of the incredible efforts that have been made. Sneha was India's first suicide prevention helpline, so a wealth of expertise there. Dr. Soumitra Pathare, the founder of the Center for Mental Health Law and Policy, is joining us from Antigua. So we have West Coast, East Coast, India in the middle, and really mapping the globe with this one. Aziva Fatima, the senior reporter at the News Minute, who also won the Siren Award this last year for her incredible sensitive work on suicide prevention. So welcome to Azifa as well. And Jyoti Ravichandran, a trained psychologist and program specialist covering mental health and psychosocial support at UNICEF, no less. Jyoti, thank you for joining us. And finally, Avinash Kumar, the co-founder of Quicksand. He's a design strategist, researcher, and artist. And we're fascinated to know more about this campaign, how all of us have a role to play. I want to say a huge, huge thank you to all of our panelists for joining us to talk about this very important campaign, this very important issue, and to thank all of our audience members for joining as well. I think that the fact that you're here in this virtual webinar shows how seriously we all take this issue. So, to kick off, I was sharing a little bit of that context, but let me start by asking Dr. Lakshmi first and then Dr. Pathare. Dr. Lakshmi, when we talk about the high rate of suicide in India, the high rate of young suicides in India, and of course, Dr. Pathare will put this campaign in context for us, there are multifactorial causes. You've been working in this field for decades. Why do experts all say these are preventable deaths? This is a public health crisis that requires a response across stakeholders. Can you share a little bit of perspective for us? Dr. Lakshmi first.
See, the fact is, just to give you a perspective, if according to the National Crime Records Bureau, there are about 170,000 suicides in a year in India. Okay. Can you think of any condition where you lose 170,000 people to a particular behavior and nothing has been done in a synergistic manner? We lose more every year than we have lost in COVID. And the kind of response everybody had together for COVID is what we require if we have to do this. And the biggest challenge is majority of them are young people. Most of the suicides in India are young people. So it's a loss not only to the family, but the community, the economy, the country, and everywhere. So the fact that it is a major public health problem is, I would say, an understatement. I would say it is the crisis which needs to be addressed immediately. Because by doing the stats, we we know that every suicide or a suicide attempt affects at least 20 to 30 people around that. And if I'm forgetting the impact of that around them. So if we do the stats, then 1 in 57 people in India would be affected by the suicide or suicide attempt of a family, friend, or colleague. And uh, that is a major issue which needs to be addressed to improve the mental health of the entire country.
100%. Dr. Patari, when we talk about the suicide rate, we've also spoken in the past about numbers being underreported. But the fact is, even that reported number for India, for children and adolescents, is twice the global rate. Can you talk us through, Dr. Patari, why this campaign? Why do we say that these are preventable deaths and that we need multi-stakeholder collaboration? You know, all of these words that we say in webinars and in rooms, but you've been saying that we do need to break those silos. You need policymakers on one hand, you need the media, you need folks across the board. Can you share a little bit about this campaign and what we're trying to do here? Doc, you're on mute.
Thanks, Amrita, and thanks to everyone who joined and all of our panelists. So why this campaign? I think that's really what I wanted to talk about, because I think everyone else can talk about all the reasons for suicide and everything. But I've been around for a while, and I'm getting close to my sell by date, and I'm really annoyed and pissed off, to be really saying it, that we have like 10,000 children dying of suicide every year for the last 4 years, and nobody's doing anything about it. It's every time I bring it up with anyone, I only get a shrug of the shoulders. And it's like, and at best, when we talk about it, we just start some blame game. We start blaming, oh, it's them, it's them, it's them. So, it's just getting really irritating. And I don't want to be going to my grave telling myself that I didn't do anything about this. And so we just thought we had to send this up. This is not a problem for say only the government to deal with. I think we as civil society, all of us, you, me, and everyone included, not just the people on this webinar, but the entire society, there's a lot that we can do about it. We can, so, the idea was to try and build this as a public campaign, which means that we all get involved in our own little way, in our own different way. Let's say you're a school administrator. Maybe there are things you could be doing. Or you're a parent. Maybe there is stuff that you could learn for yourself. Or maybe you're a reporter and there's stuff you could do to help prevent suicides, because all of us can play a role. And so that's what this whole campaign is about. This is not about a research project or something that we are trying to set up. This is not about trying to say, oh, we want to do this project or we want to do XYZ. So the plan is really to engage and involve everybody in this. And I know that it sounds ambitious when we say 10K to zero, but the idea is that if it's 10,000 suicides, we want to bring them to zero. Even if that sounds too ambitious, I would rather be ambitious and fail than to be timid and succeed. It's much better that way. And so it's great. And Avinash has been a great partner, and finding Avinash and I have worked before. And so, that's been wonderful. I'm sure we want all of you to join in, everyone who is here on this seminar. If you know people outside, get them to join in. If you're a funder, ask yourself, how can you help? We need more research. We need more policy action. We need more advocacy. And we need actually interventions happening. So like one example, I'll give you just one example and then stop. We know that training school teachers for gatekeeper training, which is called gatekeeper training, actually can help reduce suicides among children. So, people have been doing that a little bit here and there, some program here, some program there. And so what would we want out of this campaign? Like, we want every single teacher in this country trained has had gatekeeper training. Now, if that means training 1 million people or 2 million people, let's just do it. We need to be ambitious. We need to be saying we are going to do it for the whole country. Just doing a little bit here and there in 2 or 3 schools is not going to help anybody. So yeah, I'll stop here. Thank
Yeah.
you.
No, I love that. And I think that's the motivating, that's the call to action. We're going to come back to the call to action because, again, like you said, everyone has a role that we can play. Jyoti, I'm going to bring you in here because it's one of the facets of this. When you start working on, and my background is as a journalist, and I'll come to Azifa as well. Even as a journalist, even as a reporter, even as somebody who talks to experts about suicide prevention efforts, suicidal ideation, we know that there's a tendency to kind of shrink away from this subject. People get very uncomfortable. I just wanted to let the participants in this webinar know that, we're not here to depress you. We're not here to make things worse. We're actually here to have a conversation, to let some light onto the subject, and talk about what we can actually do. There's a call to action, as we said. We don't talk about it enough, Jyoti. Not the media, because we get uncomfortable. We've heard that, schools don't want to talk about it because there's this fear that you'll give people ideas, which we know is a myth. It's a misconception. And when I was chatting with you, you said mental health experts also don't want to talk about it. So we're kind of in this weird space where everyone's like, no, 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 it's not my problem. It's not my problem. Can you share a little bit about why that's an attitude that has to change, including with mental health experts?
It's just, thanks a lot, Amrita. It's and also it's wonderful to see the rest of the panelists. Definitely, we're not here to depress everybody, but it's like what Soumitra was saying, right? Just the energy and momentum towards this issue. It is really not as bullet trainish as it should be, and so that way, just this group with the diversity of experiences to come together, and also so many people joining the webinar. It is such a energizing moment actually for us to talk about this. So with that, why do we cringe away? It's just humans are bad weather animals, right? You talk about thunder and lightning, it's immediately you're going to be like, whoa, what? And this is one of those things that it's constantly obviously connected with just despair. It's absolute despair. It's absolute hopelessness. And it's just beyond this, there is no go. And this is the only viable solution. And that is a pretty dark place. And the thing is, we've all been there at some point, or we will get there at some point. And you have people that you know around you who've been there. And that darkness is something that you want to protect yourself from very naturally as a human being, right? It's like, I know friends who would be like, they would love anime, but this thing on horror, no thank you, not going near it, right? And it's just self-protection. Now it becomes a huge problem when this sort of self-preservation is institutionalized into training. So it's like, for example, you have a 22-year-old who's finished their master's and then they are inside a clinic and they've started with their brand new master's degree and wanting to really work with people. Suicide risk assessment or going anywhere near that as part of the case history should be that routine. It's not there. So you would ask about appetite, sleep, relationships. You don't even ask them about their habitual coping mechanism. So when anything goes wrong, how do you cope? That is not part of the person's case history, right? And there are all kinds of tools, for example, that are there, screening tools, etc. The language can be pretty off-putting. It's just not, I don't see my experience as being reflected by the way that this particular phrase on a questionnaire is there. So there are many families, many adolescents and children who, when you ask them, you look really uncomfortable, they'll be like, yeah, I don't want to be here. My parents got me here, so I have to talk to you and tell you what's going on in my school, etc. I don't want to, right? So it's like, what are we training our people on? And why are we not taking this discomfort of professionals seriously? It is obviously a daunting thing to talk to somebody about ideation or assessing their risk, because you have to ask very specific questions for their benefit. But then we don't usually ask these questions for anybody's benefit in any other context, except maybe, in like, physical sort of like illness clinics. But then when it comes to psychology, that becomes really difficult. So that is something that just needs to be, kind of changed, because every psychologist must be able to, and it's not, they usually find it great to just make a referral to an emergency or a psychiatrist and like put them on antidepressant medication. That is not the way to deal with risk of suicide in human beings, right? It's like, that's really not the pathway, but that's what we do. because you immediately just distance yourself from. There are other experts who can do that, but I can't kind of get into that right now. So that is a huge problem with the institutional response to suicide.
Yeah. And, this is the problem with that discomfort is what we're seeing play out, with young people, especially leaning on chat GPT or LLMs and getting all kinds of twisted and terrible advice, which we may flag for later. But Chandra, let me come to you to talk about the importance of centering narratives of lived experience. We've done interviews with folks in the past, survivors of suicide loss, who also say stop only focusing on celebrity deaths, talk to actual people behind every statistic. And those statistics are awful. If we're talking about 10,000 young lives a year, behind every statistic is a human being, is a child, an adolescent. You've talked about the importance of centering that narrative of lived experience for suicide prevention efforts as well as suicide postvention. Can you share that a little bit more on that with us? And also, what's missing when you look at suicide prevention strategies and you take a sort of macro view? What's missing?
Oh, there are a lot of gaps. So if you can poke holes, I think the whole fabric of suicide prevention, postvention will be torn to shreds. So it starts from micro to macro to everything. You can poke holes everywhere. We are lacking in every sphere, according to me. I speak as a lived experience researcher because I am affected by suicide. As a clinical psychologist, I never thought it would come to my door. That's as crazy as people think. We think that it will never happen to us. It's always someone else's problem. It happens to someone else. You may lose your clients to suicide, fine, but it's not come to my doorstep. It is come to my doorstep. I lost my son. You have to think bigger than, like what Jyoti said. We need a different way of doing anything related to suicide, whether it's prevention or postvention. You have to reimagine it completely. And I agree with what Soumitra says. It has to start with me. It cannot be a teacher's responsibility. It cannot be government responsibility. It cannot be someone else's responsibility. It has to be me. It has to be me even when it did not happen to me. I think that is the outlook that needs to change. Lived experience happens only when you are sitting with suicidality after losing someone, sitting in postvention, lamenting over the loss. We should not get to that point. No one should have a lived experience. How do we do that? We have to do that through this campaign, that no one has a lived experience of suicidality or suicide attempt or even a successful attempt. And that's where we have to reimagine it. Why should we involve everyone? Celebrities aren't talking enough about their experience with mental health. There's a very odd celebrity, even far fewer in India that actually go out and say, yes, I'm struggling with mental health. Unless it happens like a Sushant Rajput kind of a case, it doesn't even make it to the media. Who does talk there? Every one of us should be talking about dealing with mental health. We all do, but we keep it silent. We wear our mask. We don't want to say it because we think we're going to be judged. We're going to be stigmatized. We're going to be labeled. I think we all do. We all have to start that conversation of, I am not okay. I am struggling, and normalize that conversation as much as we can, and not wait for some other person to share their story saying, I lost my son, I lost so and so. We do not have to wait to that point. And I think that's what we need to change in every single way. So I speak as a researcher, as a therapist, as a parent who is bereaved by suicide, that it has to be conversational. It has to be now. It has to start with a normal conversation about mental health.
No, thank you for sharing that. And again, so sorry for your loss, Chanda. Thank you for, sharing the urgency also of this, right? This is not something that's theoretic and out there, as you said. This is one of us. Azifa, when I come to you, and we'll talk about the media because you're a journalist. Of course, nowadays, we also need to talk about how everyone thinks they're a reporter. Everyone is a storyteller. Let's be fair with social media. So there are guidelines when it comes to talking about or reporting on suicide. There are guidelines you're very well aware of. Can you talk us through, as a Project Silent winner as well, talk us through some of the things that are important to keep in mind? And again, I think this has to be not just traditional media. This has to be for everyone who is, posting, sharing. we know for a fact that, with the Werther effect, there are negative consequences to reporting irresponsibly. We know for a fact that there are positive, consequences of reporting stories of hope, people getting help, people actually, finding the resources they need. So can you take us through that balancing act? While, of course, as a reporter, your job is to report a story and not have a sort of like quote unquote agenda, right? So how complicated is this, and what's your methodology and your advice to others?
Yeah, so the first thing that we mainly notice is the sensationalism aspect of it. Like when it comes to traditional media or social media or any sort of media, even individuals, right? Like we see a huge sense of sensationalism and urgency when it comes to we have to talk about the details of the act and why they did it in a kind of voyeuristic sense, not in a kind of from a place of I want to prevent it further. And even though some newsrooms we do take special care to follow these ethical guidelines and prioritize prevention, there are like hundreds of pages just going on and on about the details. And our fundamental human sense is also to know the details, right? Like to know the intricate details of the act. So it becomes our responsibility in a way to fight against the tide, like fight, cut through the noise and take our message. And one thing that we don't notice so much when we talk about prevention methodologies, when we don't report on prevention or when we don't report on stories about hope or stories about survivors, in the sense we also tend to stigmatize suicides in a way that you're hiding away these stories. And on the other hand, we are also expecting people to come out and talk about their struggles and tell out their stories so that we can help. It doesn't work that way, right? So even in our society or even around us, we tend to see the behavior that people take it very personally when somebody opens up about their suicidality or suicidal tendencies. And the minute the topic comes up, either we move over it or we make it about ourselves to talk about how we can succeed in life, or you need just a good nap to get over it. So as reporters, as newsrooms, as influencers, even our responsibility lies in taking across these stories in a way that shows that this is not the end point, right? Like we can have other help, we have resources, and we also should give them that sense of space where they feel that they can come out and talk. And I think our reporting should also show it in that way. For instance, the story that I did about teen suicides, like one of the main things that went on and on in my mind is about this particular child passed away due to an exam pressure. But what we focused on the story, we did two stories. One was about how media was covering the whole affair. Like, there was no personal space for the family. There was like cameras behind them, and in a way that you just, if you're a suicidal person, it just gets into your head, like what is happening. We know what she did, how she did, and everything. On the other hand, the story that we focused on is about why do children feel that pressure, right? Like as a collective society, it is our belief that children are the happiest persons, they are the peaceful ones. There is no worry, nothing. What worry do you have at this age? But when we go deeper, we see that children are struggling, in fact. And with social media and other exposure that they have, it just multiplies many, many times. And as parents or as family, when we fail to notice that, then it becomes dangerous. Like some random person on a social media might know that a child is facing this issue because they feel safe to share with them, but they might not have the resources. So I think it becomes imperative for us as media houses also to make parents think about it, to show them that this is a crisis, right? Like you can't hide away from it, you have to acknowledge it.
Yeah. And I think, again, reframing for editors and those of us who are on social media a lot, to say that the way you tell that story, the way that you show on showcases, something Dr. Lakshmi told us several years ago, that Papa Gino effect of showing that there is, hope, that there is help out there. It makes such a difference. And Azifa, I will say, I've never met a journalist who, once you tell them the guidelines, doesn't forgets them. They always remember, right? It's a question of getting that message across. I'm not so cynical as to say people don't care. I think once they realize there's actually data showing there's an uptick in search or suicide attempts due to like irresponsible reporting, I think most reporters and editors would try to course correct. But again, we have to come back to how people consume what we call content now broadly, right? How are we consuming these stories or these videos? And Avinash, it's really interesting to have you here. Quicksand has done such incredible work. But how are you involved? Why are you a part of this campaign? Why is it a call to action for every single person? Like Dr. Patharia said, we don't want this to be just something that is just siloed. And what can you share with us from a design, artistic research background that you think folks should know?
Sure. First of all, it's great to be here. It's really an honor to be here. And I'm definitely the least qualified in the context of mental health insights. And I'm definitely here to learn as much as everyone else here. And in some ways also, I, in some sense, represent the larger role of design and art as kind of a glue between many disciplines and a kind of a framing tool, like you were talking about journalism itself. And so I'd like to maybe point out a few kind of aspects in which design and art can fit in, and that can help you understand the role that my studio can play as well. So one, I think in the context that we're in India, destigmatization and cultural reframing of suicide, whether it's youth suicide, children's suicide, older people's suicide, in general, it's a huge canvas for artists and designers in our work and our field to bring their skills, whether it's visual storytelling, filmmaking, audiobooks, whatever the case might be, even advertising and so on and so forth, to really reframe suicide from being seen as shameful to just being understood as a systemic, emotional, and just a mental health issue more than anything else. Also, in terms of just cultural reframing, it's important to understand that like there is a complexity in India that art itself is not a mature discipline, so to speak, in today's India, right? And therefore, to see art as a language for expression or for understanding is not that well developed. But having said that, art-based campaigns in general have always proven to be, whether it's murals or theater or films or even memes for the modern generation, they can help normalize conversations about vulnerability, about failure, about resilience, and so on. And then moving on to other kind of aspects, everyone talks about safe spaces and safe infrastructures, but beyond the kind of intellectual wisdom that is required to conceptualize those, you also need someone to physically, tangibly create them, right? And at times, those are like, jobs for spatial designers, and when it comes to physical, like community centers inside a school, for example, which do not really exist in that sense for this purpose. Or it could be digital safe spaces, which are obviously super important in the world, not just in India, and still there's so much work to be done to create youth-friendly online platforms or interventions that feel trustworthy or non-judgmental or even culturally rooted, for that matter, when it comes to things like big tech platforms and so on. And then there's also, this larger sense of expression, catharsis, and healing, which obviously we all understand art as a process, maybe, not as an outcome, or design as a process and not an outcome, can provide, whether it's, participatory art workshops in schools, or like community art practices, which, a lot of the work in the development sector around India has kind of shown and kind of demonstrated over the years in several situations, or even simple things like design for play and imagination, whether it's games or playgrounds or kiosks and so on and so forth. And finally, maybe in general, from more bigger point of view and more towards the kind of like change that we want to see in the group like this, that there's also a more sort of complex aspect of design services, which is, let's say, called service design, for lack of as an overall container, which can help us look at things like implementing changes in policy or look at innovations in policy, let's say, and helping, for example, everything from creating helplines to creating counseling environments, or creating, for example, we worked with the Center for Mental Health Law and Policy over the last 3 years to set up a peer-based youth suicide helpline and a platform, and that requires a lot of design work, everything from design-based research and ethnography to graphic design to appropriate web design and so on and so forth. So these are just some of the ways in which I feel designers and artists can help. But I just wanted to end with just saying that there is a lot to be done in the design and art fields itself to elevate those as being important to Indian society. I think there's a huge challenge that we feel, regardless of it being in the context of suicide. And therefore, it's actually both these battles that we have to kind of fight, at least where I'm coming from. And that's why it's super exciting to be part of a project like this.
No, that's incredible. And also somebody needs to update the stock images that the media and everybody uses. Please, they're very depressing. They're very outdated. And I hate to use the word triggering, but they're very triggering, right? Whenever you look at there's one woman, silhouette in the dark, and it's quite terrible. So I think Avinash, your work is cut out for you. Your and Quicksand's work. But we sometimes underestimate the importance of design for those of us who are not in your field, because actually every single part of our experience is it's actually translated through that, right? So whether it's Project Outlive or it's this, you notice the font, you notice the website, you get a sense of this might be a safe space, this might be actually very aggressive typography. So it's super important. I'll bring Dr. Lakshmi in here, and just keeping an eye on the time, because we'll try and also have some open questions to our panel on what you want to see more of, as well as maybe take one or two panelist questions. Dr. Lakshmi, when we talk about the sort of importance of media, mass media, messaging, design, you've shared in the past some really interesting work you've done where even speaking to, I think it was soap operas or mass media shows in Tamil Nadu had an impact when you realized that there were certain kinds of stories that were being told when it comes to suicide. You're on mute, but can you share a little bit about the importance of bringing in actually where people are consuming content, right? Again, I'll use content in quotes. It's not just about silos, but talking to people through the shows they watch, through the pop culture, etc. Can you share a little bit more?
Yeah, see, we have worked a lot with the media in the last 25, 30 years. I think it is not fair to diss the media, because media can be used for promotion of mental health. We have used it in Tamil Nadu. And actually, if the media had not helped, we would not have been able to introduce the supplementary exams in Tamil Nadu. Tamil Nadu was the first state to introduce the supplementary exams, which reduces exam failure suicides in Tamil Nadu. And that was with the help of the media. At the same time, we also found that there were a lot of people, many of the Tamil soap operas were showing self-immolation. They have a female character, there will be an interpersonal problem. They will immediately go to the kitchen, pour kerosene and set themselves. So that was shown very graphically also. So we got all the Tamil producers, serial producers, and gave them that vision. And there was a lot of dialogue. They said, look, I'm not saying you should not mention suicide or people will not feel suicide, but you don't have to show the method graphically. So then actually the first person who took a pledge was the AVM group. AVM Saravanan said, okay, I will not show self-immolation in our serial. So then with that, we went to the other serials and told them that, this is what is happening. So then we got everybody to pledge that we will not show self-immolation in any of the Tamil soap operas. And we have shown that there is a 40% reduction in self-immolation. The best thing was, about a year and a half back, one serial showed self-immolation. And I got a call from another serial producer saying, Dr. Lakshmi, this has come, you better talk to them. So I was able to talk to them and tell them, see, nobody is, and you have shown this. And immediately, in the next episode, he came out with a disclaimer saying that, I'm sorry for that. We are sorry we have shown that, So which was pretty good. It's as I said, how we use media is very important. To just share another example. I don't know how many of you know of this very famous director called Balachandran. Okay. I mean, you are much, if you belong to another generation, you would remember the movie Ek Duje Ke Liye. Okay. In that Ek Duje Ke Liye, both Kamala Hassan and Rati Andriputri will die together. Okay. So I actually had to go and went to call Balachandran to come and be a chief guest for a Sneha function. And he practically cried and said, ma'am, the movie is a huge hit. It has gone into the Hindi market and it's a huge hit. But look at the number of letters I am getting. all these letters are saying we also feel the same way and we also want to do the same thing. With this, I'm sure some people would have died. With what courage can I come to your organization and be a chief guest? I said, sir, the only thing which you can do is take a movie where people who are suicidal find meaning in life, find hope in life and live. That is your only price you can do. And then he took a Tamil movie which is called Vaname Ellai, which means sky is the limit. Okay, where 4 friends who are suicidal get together and decide to postpone their suicide for 1 month and do whatever they felt like. But all 4 of them find a meaning in life and live. And that also became a huge success. Then he called me up and said, Dr. Lakshmi, now I can come and be a chief guest for your function. And he came and he narrated the whole story to everybody. And why I'm saying this is how the media is so powerful is we know that recently that Natu won the Oscar for the music from a Telugu movie. The music director, the first music he composed for the Tamil film was Vaname Ellai. So Vaname Ellai became a researcher after that because that was the first movie he composed music for, and now he has got the Oscar. So everybody started watching Vaname Ellai again, and a lot of people called Sneha saying, I was feeling suicidal, but I saw the movie, So that is the power of media.
Yeah.
And we should work with the media on that. See, it is not, in fact, we work very strongly with the media, and the press council has come out with in September 2019. But I told Justice Prasad, with whom we work, it's just a short statement. So, but it is not being implemented. Nobody is being implemented. And then he wrote to me saying, show me all the people where it is being transgressed and I will take action. Then the whole media will be taken into action. And that's not what I want. We have to work with the media, educate them, increase the awareness. And now, for example, now in Tamil, in South India, at least in Tamil Nadu, no suicide story is printed either in Tamil, in English papers or Tamil paper without a helpline being mentioned. We have been able to achieve that. So it requires constant effort.
Yeah, no, that's huge, and that's actually an inspiration, or we'd call it a pilot for the rest of the country to follow. Dr. Patari, there was a question from a survivor of suicide loss who has. I'm just going to rephrase because I can't read it now. It seems to have vanished. But I raising a good point that despite access to all kinds of mental health support, they lost a beloved relative to suicide. And asking, about the framing of this campaign, you alluded to this earlier, saying you'd rather be more ambitious, and rather than timid. But there's something about, there we go. While we need to be ambitious, can we also be realistic? Can you read this here? I think it's come to all of the panelists as well. I think we'll just have to paraphrase this in the interest of time. But basically saying all of these seem much too daunting and an impossibility. While we need to be ambitious, can we also be realistic? So in terms of your, approach, and I would also be coming to all the other panelists to talk a little bit more about this. 10K to 0, it is an ambitious
my
target.
Internet seems to be bad. Can you hear me, Amrita?
Yes, now I can hear
Because
you.
You were breaking up as you were speaking.
Can I interview here?
Yeah.
Or is Soumitra talking?
Both of you are talking.
Okay.
No, go ahead. Lakshmi, my internet is bad, so why don't you answer that?
I agree with that statement. I think by saying 0, we kind of set ourselves for failure. Are all suicides preventable? No, but majority of the suicides are preventable. Okay, so to set we have 0 suicide programs in the US. When you say 0 suicide program and you work towards it, and then a suicide happens, then you feel very dejected. Or I have worked so much on it. But the most important thing is that we have to remember that majority of the suicides are preventable, not because of what you and I say, but because majority of the people who are suicidal are ambivalent about suicide. The wish to live and the wish to die is like a seesaw battle for them. What we do is to catch the ambivalent movement and increase the wish to live. Okay. So if you can say, I can make zero, I mean, I have been in this field for 40 years. Can you promise zero suicides? No, I cannot. But is it a goal which I aspire to? Yes, definitely. Okay. But we have to know that majority of the suicides can be prevented.
Oh, thank you, Dr. Lakshmi. That's super helpful. Dr. Patare, can you hear us now? Do you want to?
I can. Yeah, I just wanted to, I think Lakshmi did answer that. It is, in some ways, it's always good to have an impossible goal, because it means you're never going to reach there, which means you're always going to continue to strive. The challenge has always been about setting, in the name of realism, the challenge is that we sometimes set ourselves too timid goals. We say, oh, we want to do this X, Y, Z, and that actually then limits how much effort we make, because we only want to do this much, so you do less effort. I mean, I'm not at all trying to say that every suicide can be prevented. In fact, when we were calling this campaign, Avinash and I, we remember we had this discussion. I was saying, well, you shouldn't call it 10K to 0. We should at least say 10K to 1, because statistically it'll never go to 0. But at the end of the day, when you design a campaign, you also want to kind of capture a certain way of conveying, and that's what you're trying to convey. As Lakshmi said, is this something to aspire to? Yes, it's something to aspire to. Will we ever achieve it? Probably never. But that's the way you want to kind of build up and talk to people about. And this whole idea that, but let's be realistic. To be honest, I'm tired of being realistic. I've been realistic all my life. I don't want to be realistic. I want to be unrealistic. I want unrealistic ambitions. I want unrealistic goals, especially when it comes to suicide. Yeah, I want a zero goal. It's unrealistic, but that's what I want. We really need to kind of push that message out currently.
Yeah. But also a huge thank you to the anonymous person who sent that. And we're so sorry for your loss. Please share your suggestions if you have any. You're just being here is actually a big boost to the campaign and these kind of efforts. I think what we see, we're seeing a few more questions coming in. So I'm going to seed a question for our panelists and then ask you a few of the audience questions. Before we close, I definitely want to ask each of you what your open call is, whether it is to funders, whether it is to policymakers, whether it is to the media, or academics. That's the call I'm going to probably wrap this with. So I'll seed that for you. For the moment, Jyoti, perhaps this one might be for you. Asha asking, how can we make school teachers understand that peer pressure and stress is real amidst children? And how can you make them and parents aware of this? Let me, layer on someone else's question talking about how can parents know that something is wrong, especially given social media. I think this is a question other people can also take up. But Jyoti, from your point of view, how do you, because it's very easy to dismiss, as we talked about earlier, minimize, dismiss, and say, oh, it's not a big deal. It's just an exam. Don't be stressed. Whereas actually, of course, the stress is not coming from the child. It's coming from the systems, right? So your response to that?
I think oftentimes teaching and parenting can go on autopilot. So what you've been handed down, you just hand it over. For example, we did this a very small group on POCSO laws, okay? And usually if you ground abuse or neglect and everything in law, saying if you did anything on a spectrum of abuse to a child, you will lose your job. So when you're couching it in legality, people will get very defensive and very anxious because bad weather. You don't want to listen to all of that. But when you couch it in their own experience, right? It's not like we don't understand violence as an individual. It's not that you not felt helpless around an adult who was coercing a certain behavior from you and you would be punished if you didn't behave according to that standard. Everyone's felt that. And we had a teacher who really kind of had this sense of her experiences of being bullied. And it came to her in a really proximal sort of like memory, right? Like I remember being 8 years old. I remember having this skin. I remember these people talking to me like this. And the entire approach to empathy towards what the children are going through is so much more when you can inhabit yourself when you were 7 years old, when you can inhabit yourself when you were 8 years old. That just makes it easier to connect with a child. I think in terms of both teachers, it's also couching it in policy, right? Like India does have a national mental health policy and an act. Suicide prevention is not quite a part of it. Although it talks about, prevention and promotion activities more broadly, but then, we're not really talking about responding and putting in. I really appreciate what this commenter had said about it's about quality of care, right? And putting in systems of care. And also completely agreeing with Dr. Lakshmi and Dr. Patare, where we say we're accountable for the systems. And the systems are parents listening, me as a friend listening, me as a teacher, you as the government or a certain organization or an institution. We are accountable for all of these systems being responsive. Because depression, suicide, I mean, they're not like malaria and dengue, right? You can't eradicate them. That's the human condition. But what kind of systems are you going to put in place that is responsive, knowing that this is a very normal, regular human condition? Everybody is going to arrive here and we are ready.
Yeah. Yeah. And, Chandra, Azifa, and Avinash, I'd like to bring you here, to talk a little bit about what is the role we can play as peers, families, friends, because a few of the questions are pointing out, of course, there might be a resistance from folks to seek out help professionally, right? There might be resistance for someone to go to a mental health expert. Someone has asked, what are some of the signs I should be looking out for in my child? A professor is asking, how can I help my students when there are family problems? And we know from the NCRB, again, these are obviously very broad questions, but we know from even the NCRB data saying that family problems, were considered one of the multifactorial causes for 25% of the total number. So it's very complicated. But maybe Chandra, Azifa, and then Avinash, what are some of the roles you think we can play when it comes to, for example, doing the gatekeeper training, learning active listening, keeping an eye out on each other, because this is a community issue and a community solution is needed.
I'd like to chip in, and I'd like to also acknowledge the person who had shared the story of suicide loss. Really sorry for your loss. I sit in that space. But at the same time, I also know from the comment that the person had tried everything, went to a counselor, got the help. I ticked all those boxes myself with my own son. Sometimes it was not enough. Sometimes those are also not enough. Like Dr. Lakshmi said, not all of it is preventable, but we can get there. And we can get there only by acknowledging that mental health is an issue, looking out for signs, those are there, that is there in many communications. You don't need a rocket scientist to kind of decode that. You know when things are changing. And that's when you have to get that kind of help into a person who is feeling suicidal, who has those thoughts, who's conversing about it. Even after that, it's not foolproof, because there are other things beyond what a parent can do, what a school system can do. You cannot get school counselors right away. You cannot change where the counselors are sitting. In my child's school, the counselor was right there, out in the quadrangle where everyone could see if the child is going and accessing a counselor. That itself is stigma. So how are we looking at placing help? How are we looking at children accessing that help? Who is the confidant who they can talk to? Do they have enough peer support? So that's why it is multi-pronged. It is not just one parent trying to look out for signs. How long can a parent actually do surveillance for 24/7 on a kid? Do they have access to all the systems? Do they have access to computers? Do you have the access to mobiles? What kind of gatekeeping does a parent do? What kind of gatekeeping can a teacher do? So it involves every single person in every single step. It's not just the parent, it's not just the teacher, it's not just the system. It has to be thought, it has to be as foolproof as you can make it. But still, there are no guarantees that the person will not attempt suicide or will not die by suicide. We can only try to get that far.
Yeah.
What has helped is sharing. What has helped is sharing stories of mental health, sharing stories of positivity, like Dr. Vijay Kumar, like Dr. Lakshmi said, sharing stories of person who has gone and has turned back. has decided to kind of, change the system, and that requires that kind of help. That's where even people who are bereaved by suicide, you share your story with someone else. That is powerful. That says that there is hope for someone else to kind of look for it, to watch the signs, to keep asking the child if everything is okay, to keep asking other people's child if everything is okay. So it's not just you, it's the entire community that you're looking for. I think that's important.
I love how everyone on this
Sorry.
panel is more articulate than the next, and you're all making the point. We all have a role to play. I love that. Azifa, Avinash, do you want to come in here? And I'm also going to do a round of the panelists to ask you, what is your call to action here? What do you want? Funders, anyone on this call? There's 125. There were 140 earlier. What do you want to see from everyone? But Azifa and Avinash first.
Yeah, so one thing that struck me when Chandra said is like when children turn to different people, right? In different ways, they do that. And one of the main source that they turn to when they feel like they can't talk with others is social media, obviously, these days, right? It might be interacting with others or going to specific pages or anything. And in that sense, I feel like even mass media or social media, we have a lot of subtle messaging or unintentional messaging that shows that uh, if a person dies by suicide, we see a lot of messages, a lot of sympathies and everything. And when we see a survivor, it becomes more about, why did you do this? Like, are you not strong enough? Or I am there, why can't you talk to me? Like, the focus automatically turns to others instead of the person who is struggling. And I think that also in a way sends a message to whoever is ambivalent that, if I don't end up dying, then I will have to face this. So this also pushes those who are on the fence to one side, I would say. And another thing is when it comes to addressing this issue through reports or through our stories and everything, I think one crucial thing that we should always keep in mind is the intersectional aspect of it, because we look for a solution like one size fits all solution sort of thing, right? Like it becomes like a checklist, like in a story, did you put this, did you put helpline, did you put this? But in our newsroom, one of the main things that we see is, are we humanizing the story enough? Are we talking about the intersectionality here? Are we talking about the complexity in this issue? Like, the main problem that I say is putting it into one box and trying to manage with that. So I think media can help in that way to flip the narrative away.
Yeah. And also the messaging becomes very fear-based, right? And shame-based, and that stigma just keeps perpetuating. Sorry, Chandra, you were going to say something.
I'm just going to add to what Azifa said, and she did point out to intersectionality. I'm talking about a privileged lot, okay? I'm a privileged lot. I could get my kid to a counselor. I could get my kid to therapy. What about people who can't afford therapy? What about people who don't have any clue? We are really talking about people who are marginalized, people from different sects, people who are from Dalits and OBCs who get much more piled on, they have racist slurs. They have people who are kind of, looked at very differently, shamed upon. We don't talk about any of that. And that does add to them being more pressurized, more marginalized. And we know of kids who have come from marginalized backgrounds into pioneer institutes. They are ostracized for their casteism. They are ostracized for where they came from. They pass by suicide. We don't even talk about that. So I agree with Azifa. Intersectionality is huge. We are talking about people who have money, who have access. What about people who don't have access, who are not talking about it, who don't have the language to even communicate about mental health? We have lot of ground to cover. And I think that's why it cannot be a one kind of a solution for everything. We have to approach it in a very, very, in such a way that everyone can understand. It should not be a barrier in terms of language, in terms of caste, in terms of money, affordability, accessibility. And we have to break down that one by one. And I think all of us can do that through media, through design, in different ways. I think each one has a part to play in terms of helping untangle that one particular knot.
Yes. And the fact that there's so many people just on this live webinar, and of course thousands more will watch it, just shows that there is interest in being a part of the solution. I will say that is a silver lining. I see Dr. Pataria has his hand up, and then we will do the call to action from everyone. What do you want to see? Dr. Pataria?
Yeah, I just wanted to pick up from what others have said, which is, look, there are like let's I'm very simplistic about this, and anyone who's worked with me knows that is that I just think that if you have got a problem, you need to ask yourself the scale of the problem and make solutions which are appropriate for that. So let me give you an example. There are 10 million school teachers in this country. Okay, how are we going to build a program for scale which will ensure that every single one of these 10 million teachers has been trained in suicide prevention? And that's really what we want to do through a campaign like this. There are 240 million children, which means there are 500 million parents. How can we train the 500 million parents to be able to speak appropriately to their young adolescent children who might have suicidal ideations? That's the scale. We have to, in India, we have to build for scale. If we don't build for scale, we will just be talking about this and having these wonderful
Yeah.
plans and programs, but 10 or 15 people here and there get affected. I really, really think, that's the reason for this campaign to say, look, we can't build for scale doing it on our own.
Yeah.
The way we will build for scale is if we all join together, if we all
Yeah.
get in there. And you could be anybody. You could be a funder, you could be a parent, you could be a teacher, you could be a school administrator, you could be a journalist, you could be someone like Avinash. All of you and all of us can actually join together and build for scale.
Yeah.
We're not going to stop this unless we build for scale. That's my point.
Yeah. Yeah. So Avinash, finally coming back to you to kick off the final question from my side to our amazing panelists. What would you like to see, whether it's from funders, from people consuming content, from other designers? What would your call to action be?
Well, one, I think just to kind of iterate the point around being creating knowledge and resources and infrastructure that are inclusive in this complex kind of intersection environment that we live in. The second, I would think, would be just to respect the power of art to be a testimonial kind of instrument. More than other mediums that we have access to, art has the power to create testimony and memorialize like stories of those that are lost and use that as a stepping stone to greater learning. And finally, I think just to create alternative futures. I think art has the possibility of creating alternates more than other mediums can, and often alternatives give hope in very dark situations. And I think that power of art has not been instrumentalized as much in the country as we could.
Yeah, and that transcends so many things, including words. Thank you, Avinash. Dr. Lakshmi, what would you like to see, whether it's from funders or teachers, academics, media?
Okay, I have 3 points. One is that if we have to succeed in this, we have to think of the fact that majority of the young people's suicide below the age of 18 in India occurs in girls in rural areas. So unless we reach them, as Chandra said, all these marginalized who don't have access to healthcare, don't have access to anything, because this is the only age group below 18 is where girl suicides are more in India, even according to NCR. Okay? So we have to see how we can make it, accessible for the entire country. This is a challenge which we need to address if we have to make this a success. The second thing I strongly feel is, particularly not only in urban areas, even in rural areas, we have enough research to show that social media has a huge impact on young people. As the Swedish Prime Minister said, it is big tech versus small minds. It has changed the fabric of traction, it has changed the fabric of support, it has changed the fabric of, and we know that more than 1.5 hours, every 1 hour increase in social media usage increases anxiety and depression by 10%. And now we know that even, for example, we recently published a study where we looked at suicides of 14 and 17 across all the states. We had to file an RTE to get the report. So to look at the states, and we grouped the states according to their, their socio-economic index. And we found that the 14 to 17 years, the highest increase in the last 10 years has been in the so-called developed states. Okay? So there is definitely a link between social media. And I think I would call out for the social media. We have really unleashed this social media without any guardrails on young vulnerable minds. And that is something which I would be a big call for action. The second thing is that just as there is no single reason for suicide, there is no single point of intervention for suicide. You can intervene at every level, all levels, by everybody. We can nest suicide prevention in child programs, nutrition programs, mental health programs, maternal program, education program, legal program. So we have to nest suicide prevention in all the welfare programs. That is my second thing. Third thing is I always like to think about positive. There's no point in thinking about what we cannot do. We cannot change the genes. We cannot change biology. We cannot prevent mental illness or something. But we have, for example, we have enough evidence where we have studied, it is a published paper from WHO, where they have studied 150,000 students in low and middle income countries. And they have found that children who sleep 8 hours in the night, children who have fruits and vegetables, children who are engaged in physical activity have less suicidal ideas and suicidal attempts. Children who drink more colas, more junk food, sleep for less than 6 hours, and have limited physical activity have higher suicide. This is a messaging which we need to impart to the people. And this has a clear evidence. And we have to look at the positive. What is modifiable, we have to modify. And that is, I think, is very important. I also believe that this campaign is very important because losing a child is a trauma not only to the parents but to everybody around. Okay? And to see young people who we think have the life ahead of them choose to end their life is heartbreaking for any adult. So I think we have to be all in this together, and we can all work in whatever way we want. Everything will have an effect. Okay? Only thing is we have to be consistent. We have to keep on working at it, and then we'll reach somewhere.
Yeah. Jyoti, to bring you in there, I love that no single point of intervention, as Dr. Lakshmi was saying. Jyoti, what are your, then we'll do Jyoti, Chandra, Azifa, and Dr. Patari will round us out for the hour. What would you want to make your open call, your call to action?
I think really to systems and to colleagues, no matter where you're working, no matter what you're doing, it's really, there are multi-dimensional. You mentioned it at the beginning of the call, really kind of characterizing suicide as a multifactorial phenomenon. Risk factors are everywhere. We're talking about intersectionality now. If you just look at the NCRB data, the kind of ways in which populations and their percentage have been sliced, that will really tell you from unemployed to employed to rural to everywhere, married, unmarried, single, divorced, everything is there. Can we make systems in health, education, and really protection, like just prevent violence? Child hunger is highly associated or correlated with later suicidal ideation. So it's as Dr. Lakshmi said, there are all of these very fundamental evidences that are there for our health systems, for our education systems to really kind of take up and make life a pleasure for a child to live in these environments. So the call will really be to make an environment child-friendly. Like if it works for an 8-year-old, it'll work for an 80-year-old, and vice versa. So just like make the space inclusive where everybody can walk in and get the quality of education, quality of healthcare, quality of protection that we are all entitled to.
Thank you. I'm sorry. There's another anonymous, point, and maybe Chandra, you can address this as you're doing an open call to action. Someone talking about the guilt they feel because a close friend lost their daughter due to academic stress. They sensed something was wrong but couldn't do anything. You will hear a lot of this, of course, right? The guilt, you alluded to it as well. Can you address that, and then maybe your open call to action?
So if you lose someone by suicide, the guilt stays with you forever. And the guilt comes from, I could have done this, I could have done this, I could have done this, I could have done more, I could have seen this, not seen this. You have to live with it. There is no quick fix for the guilt. There are various ways in which we can also deal with it in a different way. We can do mental health differently. I research stories and narratives. I research stories for children. You can talk to children. You can talk in different ways. You can use methods that are very simple, doesn't require any massive gadgetry to start a conversation on mental health. We can have that conversation with anyone who's right next to you, just to ask and check in whether they are okay. And I think that's what the whole gatekeeper training that Soumitra was talking about sits in. It doesn't have to be fancy. There have been various examples across the world, like the friendship bench recently, that doesn't require much, just two grannies sitting on a bench talking about mental health. So the only way we can turn this guilt into something more proactive for ourselves is to kind of do something about it. And when I say do something about it, is to start the conversation on mental health. I'm not saying that we are here to stop someone from jumping off the bridge or doing something harmful. We never know when that's happening. But by even checking in, I think we can show that we care. They know that there is someone listening to them. Small fixes, not big ones, but those small fixes do help. And that's why whatever we are doing in this sense, discussing how media can help, how we can help in schools, how we can do gatekeeper training differently, how we can even look at reducing exam stress or even designing things differently. All of this has a connection to the larger jigsaw that we talk about in terms of fixing the pressure cooker that is building in children every single day, in us as well, but mostly children. As a parent, you can do everything. You can do the checklist. How far that will go is a test. It may not happen at year 17. It may happen at year 30. We know the suicide spans an entire generation. It need not be young or old, but we can try and start looking at fixing the mental health issues early on through conversation.
Through conversation and storytelling. And again, thank you for sharing that. We're sorry for your loss. I would just add possibly, check in on your friends, because we tend to forget the survivors sometimes in all of this, right? So one way of building on what Chandra was saying about the guilt, I've seen this myself, is, take action in some way, try and be there for the folks who are also bereaved.
I wouldn't even put
Chandra?
it only as survivors or people who are bereaved. Check in on everyone, because you never know who's having what kind of crisis in their lives. We wear our masks very well. So I think it doesn't cost too much of money to say, how are you? We stop that. We stop niceties. Nicety.
How are you? And wait for the answer. Wait for the answer.
Wait for the answer. Don't run away. It's not on a WhatsApp that you go, okay, send a smiley and an emoji. Just have those connections, have those conversations. Wait, and be okay with sitting in silence with uncomfortable answers. That them saying that they are not okay. Just say now, there are ways in saying, okay, I cannot fix this, but can I just sit and listen to you? You don't need to have the answers. We are very, very scared of anything that is going to come our way and say, oh my gosh, how do I handle this? Why?
We can find out later the answers. I'm so sorry. We have 4 minutes. Dr. Patari, clearly we need a masterclass after this one again. Azifa, quickly, and then Dr. Patari will round us out. What you'd like to see as a call to action?
So just two small things. One is that when anybody talks to us, to anybody, it might be parent or friend or anybody, it is very easy to make the story about us, but as much as possible, we can share that safe space. And the second thing is, as journalists or any sort of media personnel or artists, we have this tendency to underestimate our own work, right? We think, who is going to see this or what impact does it create? But I believe that even the smallest story, even the smallest trigger warning or helpline helps. And another one recent thing that I noticed is that it depends largely on the way that we show or say a story. Depression or suicidality is not always so dark, so sad, and so desperate, and everything. So, as artists and journalists and media personals, we should also experiment different ways in which we can take across the message. And the recent film Odum Kudira Chadam Kudira was one of a very good example in showing how this struggle happens within us, right? And how a person overcomes that. So I think we should also experiment more with such formats to take across the message. And
Yeah.
lastly, most importantly, I think we should address and acknowledge the inequities that exist, and there is a lot of political and social layers. And any child who feels suicidal doesn't just feel suicidal because of an exam or because of a heartbreak. There is a lot of layers to it, and I think we should acknowledge that as well.
Thank you. There are like so many questions. I hope someone can take them up at some point. But Dr. Patari, the final words for you. What you want to see? What's your open call to action for this?
Thank you. I'll be brief. There are three big pillars of action that we are looking for through this campaign. One is obviously interventions, to kind of do interventions. So, like for example, training all school teachers or training parents. I'm just giving you a couple of examples. There are many such things. Suicide is a little bit like a needle in the haystack, and the only way to prevent it, according to me, is to comb through every single haystack with every single straw, and that's the only way we're going to do it. There's no other shortcut to it, which really means I hate to use these metaphors, wrong metaphor, but carpet bomb the place, like really have to cover everybody. We just have to ensure everybody is trained in doing certain things, for example. So implementing interventions at scale is one thing that we want to see. The second big pillar of action for the campaign is advocacy and policy, so to try and get policymakers to change policies, try and get organizations to change policies. Lakshmi gave an example of what happened in the South Indian film industry, for example. Getting organizations to change their policies, to advocate with them to do those changes, or advocating with, and policymakers don't necessarily always mean government officials or politicians, but even the office bearers of a South Indian film industry, to me, are a policymaker, and you should advocate with them. So that's the second bit, which is policy and advocacy. And the third bit is to promote research, is to encourage. If you're a funder, if you are somebody who funds research, if you're a researcher, then really encouraging you to kind of do more research on the causes of and the methods to prevent suicides among children. Now, why, everyone says, oh, but suicide is a big problem. Why did you focus on children? I just want to cover that very briefly. One is because I think the whole idea of children, 10,000 children, is just way too much. It's just not right to me. And as Lakshmi said, this is the only age group where girls outnumber boys. Everywhere else, it's men outnumbering women. But this is one age group where it's girls dying by suicide. And so that's another reason why we thought. And also, I think it makes sense to people if they just put it into context. There are many countries where the total number of suicides in a year are less than 10,000. UK has 7,000 suicides all put together. Not children, all put together. We are losing 10,000 children to suicides every year. I mean, this is a scandal which we've really not been doing anything about. And I think the time is long past by doing these demonstration and pilot stuff. I think we really need action at scale. We need things across the country. We need across the board. We need to kind of get after every single suicide and prevent it or try to prevent it.
Yeah, and I think, we're out of time, but I feel like this is just the first of many. I know that this is a campaign that has been well thought out. We want everyone who's listening to go out and tell your friends, tell your peers. Don't forget to check in on each other, as Chandra said. Ask each other how you're doing. We're in it for the long haul. I think, as Dr. Patari said, for this to have impact, it needs to scale. Thank you all for your patience, for joining us for this webinar, and a huge round of applause virtually to our panelists. You're incredible. Everyone here has really gone above and beyond. Thank you for your work and for articulating so clearly today what we need to see. See you all
Thank
soon.
you.
Bye.
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 Bye, colleagues. Love to meet everyone.
Thank you.
Bye.
Bye.
Sure. Cheers.
Bye.
Bye.